Today, we're going to talk about robots and their usage in modern medicine. Welcome to the High Achievers podcast, where we host extraordinary individuals who are disrupting and transforming the way we do business and the way we lead ourselves and the way we lead others. Now, our today's guest is Australia's leading laparoscopic surgeon, and she was the first clinician in Queensland to deliver robotic weight loss surgery. Now, this operation technique is known to enable a more precise procedure and a faster recovery time. And today we will learn all about it from the expert herself. Now, please help me welcome Dr. Candice Silverman. Candice, welcome.
Thank you. Thank you for the opportunity, Andreja. I really appreciate it.
Absolutely. I'm so grateful and thankful that you've taken the time to join us out of your busy schedule. So, Candice, do tell us, as a surgeon and as someone who is enthusiastic and I guess pioneering robotic surgery in Queensland, Australia, what got you inspired to dive into that topic and study it and become an expert on it?
Yeah, well, partly chance and opportunity. Our hospital at John Flynn actually purchased a robot in 2014, so that was the first step. And at the time, I had a recent experience with a very difficult laparoscopic case, like a revisional case, and it took hours, and I was left with an achy back, and I couldn't feel my thumb. I had like a nerve injury to my thumb. I thought, there must be an easier way. I guess also at the same time, an advocate of robotic surgery, a Dr. Eric Wilson, came to Australia, and he influenced me, like, with his passion as well for robotic surgery, but also for the consistently impressive results he was getting, particularly in the bariatric field, doing thousands of cases on these, larger people, which is quite technically difficult, and getting like results of complication rates of like less than 1 in 1,000. So, I mean, to be a surgeon and to operate with like minimal complication rates and, less, physical harm to yourself, I thought, that's the way to go. So a combination of a few things.
You run your own clinic. How has that technology in general, where things are moving and changing towards, how has that changed your life and your career and your practice?
Well, it's an interesting thing, I guess. I mean, talking personally, I've never been much into business or how to make money or through medicine and then hiring staff. So the business, again, it's a little bit accidental. I've generally had other senior colleagues manage my business, and I pay them a fee. But yeah, as I said, opportunities presented, and I've bought my own practice this year.
Congratulations.
And yeah, yeah, thank you. I guess I'm still at the beginning with this, and what I've employed or tried to employ really firstly is staff and culture. So like a culture where firstly the staff are happy, they want to come to work, and they enjoy working with me. And I know, because I hear them on the phone, I know how good they are to the patients when they call up, reassuring, giving good advice, or making appointments. They really go out of their way to help the patients. So if I know that that's done, then it really takes a lot of stress out of my day. But yeah, in regard working with technologies in the clinic and the business side of things, that's a work in progress.
It always is. So I guess the next natural question is, when you have this huge transition from the way things were done, right, and the way things are kind of moving towards in terms of surgery, using robots, using advanced technology to help you with your profession from one patient to another, what would you say is the one thing that why would a patient decide to go for a robotic surgery? What are the benefits?
Yeah, well, the benefits for them, or particularly you've got to talk about a surgeon that has done a lot of robotic surgery for them, the patients to get the benefit from the robot. So I think I just have to be grateful for, the first 100 patients that let me operate, say, on the robot and have allowed me to go through that learning curve. Without patient harm, and there's a lot of like safety and implementation steps that had to be taken. So I'm grateful for those patients that have let me to do that. And now that I'm more experienced, I'm not Eric Wilson. I'm still like at the beginning, really. But I can tell them for me that it's more comfortable for me to do these operations, and often for the more complex revisional cases, so patients that have had previous surgery that might have scar tissue or complexities that need more things done, I can do it in a place that I'm not fatigued, and I think from that is going to translate to better outcomes.
To great success rates.
Yeah.
So talk to me about the technology and access to it itself. I would assume and imagine that buying a robot for a hospital is not a cheap exercise, but then also in terms of using the robot and having, I guess it's all about the demand, right? How does that work? What are some challenges that you potentially see from the positive and from potentially a bit less positive when it comes to usage of this technology
That
in the
that
future?
is so interesting. So traditionally, the robot was really taken over by all these urological surgeons doing radical prostatectomies on men. And the great selling point, I don't mean to say, but men are very concerned about what happens to their function. And if you can say the robot's going to give you better function, then of course, they're happy to pay. And then there's a marketing side of that for the hospital. And so that sort of attracts patients, not necessarily through outcomes, but just through that, if you want the best, have a robotic prostatectomy. So when the robot came, our urologists weren't using it all that much or hadn't established in the field. And then it was allocated, surgeon A on a Monday, surgeon B on a Tuesday, surgeon C on a Wednesday. And me, as I said, for me to start using the robot, I really wanted to make sure I was doing it in a safe way, because I was a bit fringe doing these obesity operations robotically in Australia, being, the first cohort to start it. So I did them all with a senior colleague, Michael Gushin. So we had two surgeons on a robot on a Friday afternoon every fortnight. Which was great to get through things safely, but there was also disadvantages for me that, organising a date with another surgeon is not always or that easy. It's like or at least in Aussie dollars, $3.8 million machine. So if you imagine, yeah, it will have maybe a 5-year lifespan, hopefully. And then if you do, say, for 5 days a week and 10 sessions a week and 500 operations a year, like the more operations you do, the cheaper it gets, to use a robot, if you follow the maths there. And also having the robot not used or in a corner means that the theatre team aren't getting the experience with it, the surgeon's not getting the experience with it, and then the patient's not getting the benefit from using it. So I guess I'm grateful to have the robot, to have the access that I do have. So I don't want to push too many buttons with it. But I think from what I've known and learned, you can't just have a robot at an institution that surgeons use. You actually need to have a coordinated program to maximise its profitability, if I can use that word, not just in a monetary sense. Yeah.
Of course. And so I would imagine that you're probably not the only surgeon in the world dealing with this issue, right?
Correct.
And
Correct.
so, since you are a speaker at international conferences, I mean, when we were still able to travel, I know that you have traveled to many different locations and you've spoken about this topic quite a bit. You've written a chapter in a book. There's a lot of articles that you've published. So, in terms of the international comparison of where Australia is and where the world is, the
Yes.
Europe, the United States of America, and so on, where do you see that advancement in usage of robotics?
Well, I mean, it's interesting. So, like every state in America has the robot, even Alaska now. So, and it's on used in every continent in the world. But I think a lot depends on your administration's view on robotic surgery. So you can some have the view it's expensive, it takes longer. Why would we bother? When you can just do those operations, with the straight sticks and, keyhole style. But I think now as more surgeons are using it, becoming a lot better, more efficient with more efficient teams, then those arguments are no longer at play. And there is, I think America is really having the lead in terms of running what I call a profitable robotic program. So this is where they get surgeons that are already experiencing robotic surgery, say, or really support them through that learning curve to get through that quickly. They've got teams that work together. They run tasks in a parallel situation, so things happen more efficiently. So turnover time improves, and then operation times decrease, and then length of stay for patients might decrease as well if they get better outcomes. So if you use those metrics, and there's some big hospitals in America that have shown that they can actually save money by using these robotic platforms, and as soon as one robot's totally utilised, and they purchase the next one. So, but that model of care and that sort of thinking, I don't think is quite translated to Australian, or currently not to my administration. And I'm sort of, an advocate saying, come on, guys, we can do better. We can get our turnover times less. We can get our operation times reduced. We can measure this. We can audit it, etc. It's a start. And yes, certainly I think that the trend is definitely that robotic surgery, I feel, and I'm saying it now, will overtake minimally invasive or keyhole surgery. It just makes no sense that you operate with sticks this long through an abdominal wall, and you're like chopsticks trying to do these operations when you can have articulating hands and be very comfortable to do it. Just a matter of time. And in the American world, even the past few years, for all their keyhole operations, it used to be like 9% was done robotic, and now it's like 16% robotic. And the prediction is in the next 5 years it'll be 25%. So, and I think that trend will continue.
Increase. And it sounds like you're super passionate about this, obviously. And I also heard you say support, mentoring, right? One of the huge aspects of using the machine properly. So
Yes.
I would love to hear your take on this. As a leading surgeon in robotics, in your industry, in your field, what is the mentorship like? How can you support others around you? And what would you say to your colleagues across the pond? What could be done better, or what are you learning from others in that field of support and mentoring?
Yeah. Well, it's interesting because it's like it is a disruptive technology, because you actually have to change your operation. It's no longer the same operation that you're doing laparoscopic. It's a different operation that you're doing robotically. So, I mean, I talk about learning curve a lot, but Da Vinci has their own training pathway. So you've got to do all this simulation training, and then you do lab work and case observations and your original operations. And Dr. Eric Wilson was kind enough to come to fly in from Houston to proctor me for the original operations back in 2014, when there was no other Australian surgeons available to do that. So there is a specified Da Vinci pathway, but I think surgeons, when they take it on, need to acknowledge that their initial cases are going to be less good than their current laparoscopic cases. They need to select easier cases to do that are short, and you can get some wins on the board. And what people need to appreciate about this robotic surgery, it's a team event. Everyone in the operating theatre has a role, and a new role, from draping the robot to exchanging the instruments, to getting the console and the IT and the video already. but yeah, there's been a few other things that have come on that have been very helpful for me because at least within Australia, the expertise saying robotic bariatric surgery is just not there. I don't see a point in seeing someone in the first 50 cases where previously I was able to travel overseas to watch, Eric Wilson, and I can name a couple others that I went to see in the USA. But I'm fortunate there's now social media, Facebook, and I'm terrible on Facebook, but I've joined some groups. They're closed groups. Specifically, there's one called the Robotic Bariatric Collaboration. So you can go on there and you can watch all these like videos, and they'll even put on stuff that we're talked about now, like, what is your current allocation process for the robot? So I now got an international idea of, okay, well, it's not just surgeon A on a Monday and surgeon B on a Tuesday. There's actually can be systems to how to, equitably allocate the robot. So that's actually been very helpful to me.
Oh, I would say so. It sounds like having that access to international experience just from a click of a button. I mean, technology does make wonders. Um,
Absolutely.
so, Candice, I would
Absolutely.
love to also hear if we continue our conversation about where things are going, right? And also, what would you predict in terms of the robotic surgery field? How is that likely to improve and change the patient or the patient's lives afterwards? What's the recovery like? And if you can just talk about the patient side.
I mean, the thing is really about surgery is trying to reduce variability. So you can do exactly the same thing every single time for these elective cases. And I think, obviously if you're comparing someone that's had a big open incision to keyhole surgery, there's obvious benefits. But when you compare keyhole surgery with straight sticks, laparoscopic surgery to robotic surgery, it's harder to tease out those benefits, at least initially. So, I think that word reducing surgical variability would be the way. And I mean, we haven't talked about, we call it a robot, but really it's like a master slave. It's just doing what I tell it to do. So there's no autonomy there. So it's actually not a true robot, but I think where the future will be in that reducing surgical variability, and that will be through really analysis of the data. So like every movement, surgical movement is now recorded, and Da Vinci somewhere have got all these operations done by all these surgeons with all these movements that in some way, I guess, can actually predict outcomes as well. So if they find, say, the formula for the best way to tie a knot or to suture up an anastomosis, or, we're talking about, having a more autonomous robot at that point in some way to reduce surgical variability. Or that might even, I'm just making things up now, but that might even be in an educational way. So they might notice, okay, well, you've had more blood loss, or your movements are all erratic, and they go, okay, well, now we've developed this simulation program. We're going to send you the simulation program. You get to practice this simulation program, then you get to hop on the Da Vinci robot for your next case. So, I mean, that's not there yet, but I'm hoping that, all this data is going to be used for good.
If we stick with the mentoring part just a little bit longer,
Yes,
your vision,
yes.
what would be your ideal vision to help and support future surgeons coming into this field?
Yeah, at the moment, like I'm talking, I've published, so they've got the information's there and it is current. I've got a fellow called Suzanne. She's a fully trained surgeon, but with an interest in robotics, and she's helping me with the data as well. And she's been very enthusiastic. So we're actually going to set up a training program for her to start using robotics. So it's not just me, I'm actually going to train a robotic surgeon. She's just one, but yeah, it's a start, and hopefully other bariatric or obesity surgeons that do robotics will then have the training pathway to train their fellows coming through, because I guess it's probably one of the downsides just introducing this new technology is the effect on the trainees at the moment that might feel like they're losing out in some ways. So I'm hoping to address that. In the mentoring, I'm sort of quite interested in doing video reviews for other surgeons if they're interested in that. So that's something, I guess, to be developed down the track. And Da Vinci have actually employed me as what's called a proctor. So it's sort of different to a mentor. A proctor, it's someone that's actually, it's like a safety agent. For the patient and for the institution when a surgeon is using a new technology. So it's less mentoring, I mean, supportive, of course, and but you're there really as a safety number and give information to the hospital to say that, okay, this guy's safe to go on his own, or girl. Yep.
Well, you're obviously one of the first adopters, right? When something new comes up, you have people who kind of look at it from afar and wait and see what's going to happen with it by the hands of other people. And then you have people
Yes.
who grab onto it and learn and pioneer and see what comes from it. And you're obviously the latter. So I would love to hear, what are some podcasts or books or just in general things that interest you and things that you learn from the most? That is, if we swapped phones, or obviously your library choice for a day.
Okay. Well, I mean, the weird thing, I video record every case that I do. So I'm often re-watching videos either with myself or patients, just so I'm almost addicted to watching surgical videos, which means I'm a bit addicted to, there's a few robotic Facebook groups that I watch all the videos on. There's a hernia group that I'm addicted to as well. What else? So in terms of like journals, I do get some feeds through my emails and I'm a bit selective of what I read for that. Other things, Tony Robbins, I listen to his podcasts. I do like TED Talks. Yeah, I do listen to the TED Talk podcasts. My last one would have been on procrastination. So yeah, that actually was very relevant. What else is on my phone? I've got the Tide Times, and of course, what else? Entertainment. I like music, so I've got a favorite radio station here that's got an archive, so I can find out all the songs that they're playing and put them on YouTube. So it's my way of entertaining myself.
Well,
Yeah, there you
you
go.
mentioned the tide times, right? And I know one of your loves and passions is the ocean. Talk to
Yes.
us about your personal life a little bit. Talk to us about your hobbies, your passions, and what warms your heart.
Oh, well, I guess it's just, to be honest, just a way to relax and not focus on anything but what the water feels like, or, and like I don't know, a terrible surfer. I spend a lot of time paddling and just sitting on the board and, contemplating not much, and prefer it when there's not much swell, and but just sometimes just getting wet and being in the ocean, and our water temperature is really favorable for that. So, in the summer get up to 25 degrees, which you just have to wear a costume and it's beautiful, and winter probably only goes down to 18, 19. So you can definitely put your head in it without an ice cream freeze. I've got a stand-up paddleboard, and when there's no wind, I paddle out to a little island called Cook Island, which has turtles. Other things, I've got 3 dogs, a couple of Italian greyhounds, and a little old Cavalier, and they need to be walked every day. I'm now, thanks to you actually, I'm now in the habit of, I do a 10-minute meditation every morning. There's like an app for that, so that's the way I start the day. There you go.
Living a life that is full. You have a family, you have your hobby,
Yep.
and you have a clinic and practice that really fills you up. But then you also find time to learn and review
Yes.
and revision, and it's a constant and never-ending improvement by the sounds of it. So if there was one
Yeah.
advice or one
Yeah.
tip that you would have to manage it all, what would it be?
Or Yeah, I mean, just in terms of the surgery and the patient component of it, it's just, I mean, it fascinates me. And I mean, I worry about my patients. So, coming to work or spending time reading up about a case, I mean, that's just what doctors do, I think. It doesn't, I mean, most days it doesn't feel like work. I'm like, I can't believe I get paid to be here is generally how I feel. And then, I guess on the flip side, sometimes it's like, oh my gosh, life is so stressful. It's not worth the money. There's no amount of money would, pay me not to have that stress. So, fortunately, that doesn't happen too often. But genuinely, I'm not a mother, and I think if you're asking real sort of time management, tips, I think mothers have got it down pat.
And so what about if I just asked you about where people can find you, if people want to ask you questions, talk about the subject of robotic surgery, and are just in general interested in what you do, where can people find you?
Well, yeah, I've got a website, Dr Candice Silverman. You probably won't be able to find me on Facebook, and don't be offended if I'm not your friend. I just can't do it. It's just not my thing. So yeah, don't do Facebook, but yeah, via the web page, and there's the contact me. That's probably the easiest way to do that.
Beautiful. And there's one last question I have for you, Candice. If you were a very junior surgeon and you started your journey yesterday, what would be the most important lesson or advice that you would have loved to know back then, and that others could learn from?
Yeah, I mean, that's an interesting question, because I can tell you the advice that I always give juniors, and because they say, how can I get onto this training program and where am I going here? And I said, all you need to do is look after your patients and everything else will follow. So that's the advice I give them. The advice that I wish I had earlier, that's a really hard one. It's a really hard one. I guess to speak your mind. Don't be afraid of speaking up when you have something important to say. I mean, that's probably my own thing. I can still be a bit more vocal. I don't speak up all that much in meetings. So I think that is important to know that you have a voice and it's worthwhile hearing. But then I go back to number one, and yeah, be good to your patients.
Thank you so much,
Yeah.
Candice. I've learned a lot. I know our listeners have as well. And good luck to you pioneering and moving forward with the field. I'm really looking forward to following your journey. And thank you again for taking your time.
No, pleasure. It gives me a good opportunity to think and reflect. So thank you.
If you like this video, give it a like and share it with your friends. And if you want to be notified every single time that we post new content, then make sure that you hit that subscribe button. Now you can watch us on YouTube, or you can subscribe to our The High Achievers Quest podcast. Thanks for tuning in.